heart to you. Before we start, stick and stay.
Joy 99.7 FM. Joy 99.7 FM.
Every makumamu, many ansem. Ampara. Kakra miwa, did it to me at the or play woman. Many ansem.
Joy 99.7 FM.
I need you more. La la ne, Milami habo, Eja inchini, Unkuya edole. Fio kolani yo, Ni kebato, Sumoni yo ile. Befeni, Obanu la la nele. Ohi akapamo, efia heni oyale. Demi shado.
Joy 99.7 FM.
Anyemi, milami habo.
I know wherever you are, you're singing along with this. I think it was 1985, huh? Oh boy. DJ Days.
Joy 99.7 FM.
Fortunately, I can't play all of this Rex James feed for you. Right, it's festive season. And we know medicines are important every single day of our lives. But particularly and specifically and emphatically during these festive times, traveling, moving around, changing schedules, you're likely to mess with your medicines. So I brought in the Pharmacist from Ad Pharma, my favorite pharmacy. Pharmacist Daniel Sarpong. And Obodai, I think it's Sai, right? Pharmacist Obodai Sai. Or Ni Sai Obodai. Well, we'll be looking through the things you do. You mess around with your medicines, you miss your doses, you mix medicines with foods and alcohol. You may not even go with a prescription. Tell a friend to tell a friend. Ultimate health is in effect with the Pharmacist. We're managing our medicines during this festive period. And guys, good to have you back in the studio after a year, right?
Yeah,
you were here last year on the 20th of December. We brought you in a bit early this year.
Yeah.
Great to see you looking good.
Thank you.
Thank you.
How's Ad Pharma doing?
We're doing great.
Several
Still
new
opening more branches.
Branches. But the root is solid.
Very solid.
Great service.
Absolutely.
Thumbs up to you, Isaac.
Inspired by patient care.
Yeah.
We are currently just expanding. Started with Moving Pig, now at North Industrial Area, at Chado, at Kolebu, the Bukum Boxing Arena. We are in Dakoma at the Total Filling Station, also at Pig Farm, the Total Filling
Joy
Station. So it's just
99.7
going
FM.
better and better.
You are adding Pharma.
Yes, we are adding Pharma.
Right. Good afternoon to you, Isaac also answer. Ad Pharma. Yes, you're going to
For the other regions, don't worry, we are coming there.
Okay.
So for Kumasi, Takrady, get ready for us.
All right.
Ad Pharma will show up soon.
All right. This afternoon, we're ready for you because it's that time of year, right? Despite COVID, even last year, people celebrated somewhat. And this year, we're in a somewhat complacent, low vigilance mode when it comes to COVID. The numbers I've seen for our vaccines, 5,724,000 and counting Ghanaians have been vaccinated. I see about 31 new cases and about 600 or 630 something active cases, the bulk of which are coming from Greater Accra and airport cases. That's my summary. COVID is still there. So remember that as we discuss managing your medicine. So why do we typically expect people to get muddled up or mess around with their medicines during these times?
Okay, so during this festive season, it's time to catch up with friends and family. And during the season, there is a gleeful sense of freedom.
Okay.
So you tend to have a lot of movements around, a lot of parties, and quite a number.
Weddings, parties.
So many.
Right.
Many. But then, during this period, the ability for our customers, our patients, to actually get out of their routine
All right.
on taking their medications is very simple and easy. So we've got some few tips
Right.
for your listeners, and as well as our patients and also our customers as well.
Right.
So there are things you need to do during this period. So refill your prescriptions early. Make sure you have enough during this period, because most pharmacies tend to change their working hours
Okay.
during this period, and some prescribers also take some days off.
Right.
So it's best you have enough of your medications during this period.
Okay. So you should know the medications you're on, and you should prepare and plan for this period. Make sure you have enough. Don't wait and say, I'll get it over the weekend, or I'll get it next week, and so on and so
Yeah.
forth. You should have enough. You should not give yourself designer excuses for running out of medication. So get a refill, right?
yeah.
Your prescriber is different from your pharmacist or your dispenser, right? Where you get your medicines is different from whoever is looking after you, or your primary caregiver who is prescribing the medication. So make sure in advance you have that. Were you going to add something, Daniel?
Yes, so another thing is that, it's a festive season. We would like to share a lot.
Mm-hmm.
So, you can share your cupcakes, share the pizza, but don't share your medications.
Oh, people do share their medication.
Yeah, some do share.
Well, I've run out, and I get yours.
So I get yours, a friend or a family and all that.
You shouldn't do that.
Another thing is that you can set reminders. It could be as simple as possible. You can set alarms. Okay, that will help you to remember that, okay, at this time I'm supposed to take this medication
Okay.
or that medication. You can deploy the use of pill organizers.
Okay.
Some are designed so nice. You see Monday, Tuesday, Wednesday.
Okay.
That would also help you to be able to remember.
Okay.
Yeah.
And these are relevant tips for every day, not just the festive period, right? There are softwares actually that on your smartphones that help you manage your medicines as well, right? They give you reminders, and you also check in when you've taken your medication. Some people take the medication and forget they've taken it, and then they take an additional dose. We'll be talking about all of those things. If you've just joined us, this is Ultimate Health on Joy 99.7 FM with me, Nortey by nature. We're discussing managing your medicines during the festive period with the pharmacists from Ad Pharma, Daniel Sarpong and Ni Sai Obodai.
Yeah.
Right?
Yeah.
Okay, I know an Obodai Sai, so anytime I get yours, then I make sure I'm not mixing it up. If you have any questions about your medicines, especially if you're on medications for chronic ailments, your cancers, your diabetes, your asthma, and other things, there's a likelihood that you might slip up during this period, and some of those slips may be costly, if not fatal, right?
Yeah.
And we're trying to make sure we give you advance advice and education ahead of this. All right. So our pharmacies typically will get busier. I always ask you guys, do you have the time and the space? Of course, you're selling and you're dispensing medications, if I'm using the right terms. But the time to give a client education, instructions with regard to their medications. Do you have time to do that?
Yes, we have the time. We have the time to do that, because the challenge we actually face at the pharmacy is most of the patients or the clients, whenever they walk in, they're in a rush to just walk out of the pharmacy.
Yeah.
So they should bear with us. We want to give them all the knowledge and the information on the medication.
Okay.
So they shouldn't be in a rush to just walk out. When you come to Ad Pharma, our motto is professionalism and availability. We want to ensure you get the best service by getting to know what you are taking.
Okay.
Because it has got implications if you don't know what you are taking.
So if I just to slip in, so if I get into the pharmacy, there's a bit of a queue or a bit of a tailback or hold up, right? Probably because over the counter you are giving somebody information they need with regard to their medication. You're saying
Yes.
I shouldn't walk out in haste or anger. I should wait my turn because I'll also get that quality care and service and education.
So you walk into a typical pharmacy, we've got places where we actually have a one-on-one conversation with our customers.
Okay.
And when you walk into Ad Pharma,
Right.
we've got not just one pharmacist, not just two, we've got quite a number of pharmacists around. So any of the pharmacists at all could give you proper counseling on your medication and your condition as well.
Right.
Because what we realize is that most of the patients do not understand their condition. So we pharmacists, being the gatekeepers,
Right.
we always ensure the patients actually know their condition and why they are supposed to adhere to their medications.
Okay. All right. So you get that over the counter sometimes, and sometimes there's a pharmacist able to make time for that specific function of counseling and educating you and making sure that you understand the medication. And of course, you are the right person receiving the medication. Danny, I was going to ask this. You know, a prescription is a prescription. Age, date, name. What is a valid prescription? Because people will come at you with things and they expect the medication. Can we just quickly what's supposed to be on a prescription?
All right. So there's an act that actually, if I'm to speak on authority, I think Act 857,
Right.
the Health Professions and Regulatory Bodies Act 2013.
Okay.
It talks about a valid prescription.
Right.
Okay. The prescription basically should be written and signed by an approved prescriber. It should also have a stamp.
Should be legible.
It should be legible.
Thank you.
And then it should be in indelible ink.
Right.
Okay, and then it should be able to state the name of the patient, address, the age, the dose, the dosage,
Right.
and the duration.
Okay.
And now, as pharmacists, we encourage a lot that the prescription should have the weight of
The
the
weight
patient.
of the patient.
Yeah, so that
Okay.
in cases of dosing,
Those
if there's any
variations,
underdose,
right.
overdose, we can be able to calculate and then
Okay.
bring to resolve.
Right. So the prescriber's full name and designation is also required,
Exactly.
right, to
Yeah.
validate. And I think also their contact number, or
Yeah.
Right.
Their contact number.
because very often you have to call them to verify
yes, please.
what you see presented.
Yes, please.
All right. Let me also ask this question. Folks, if you just joined us, we're talking about managing your medicines over the festive period with the pharmacists from Ad Pharma. But the tips and advice apply across board, not just for Ad Pharma, hopefully, right? That other pharmacies and pharmacists are following this. If you have any questions, concerns, we're live on Facebook and YouTube. And our WhatsApp is 055 11 11 997. And shortly, I will activate the phone lines. If you have any questions about your medications, missed doses, mixing medicines with food and alcohol, many other issues, we're looking at that. Right. So I'd raised this thing about sometimes the need to call the prescriber to verify. Right.
Yes.
Okay.
So usually within the hospital, in a hospital setting, the pharmacist is able to access the prescriber.
Okay.
Even in some cases, if you want to get some clarity, if you want to make any contribution
Right.
in a hospital setting, you can access the prescriber. And sometimes you can actually even walk to the ward,
Okay.
get the folder if you want to just
And follow up.
follow up
Right.
whatever is going on. But in the community setting, you would really want to rely on the contact number.
Okay.
So where if, for example, there's any kind of irregularity, with the healthcare, being a multidisciplinary teamwork, all right, if you want to seek either clarity or make any form of contribution, which we do a lot in Ad Pharma, you can privately call the prescriber.
Okay.
Okay, but this should be done without the knowledge of the patient, because
Okay.
it's very important as a professional
Right.
that the patient does not lose confidence in the prescriber.
Okay.
So in Ad Pharma, what we do is that we secretly call the prescriber
Okay.
and then make whatever contribution that we have to make. And then also, in cases where the number is not on it, sometimes we can actually write a note and staple it,
Okay.
seal it in an envelope, and ask the patient to go back to the hospital.
All right, great stuff. This is Ultimate Health on Joy 99.7 FM, 21 minutes past the hour of 2. Edith Arthur in North Kanishi says, Ad Pharma is the best. Kudos. Thanks, Edith, and hope you're having a great day. If you have any questions, concerns, 055 11 11 997 Ultimate Health on Joy 99.7 FM. We're looking at your medicine matters over the festive period. And we've got pharmacists in the house advising us. Can I travel with a prescription within the country and, of course, more interestingly, outside the country? Can I enter the country with a prescription and present it at a pharmacy?
So, no, because before you will be able to actually have a prescription, you must be licensed first within that particular region or country.
Okay.
Yeah, so if you are traveling from, let's say, the States and you're coming to Ghana and you are using your prescription there and you bring it here, we advise you see a physician first.
Okay.
Then the physician can prescribe your medication for you. If not, you walk into a pharmacy and the pharmacist would refuse to give you the medicine, and you feel the pharmacist is not being fair to you.
Okay.
But there are rules and ethics guiding the profession.
Okay.
So you just don't walk into a pharmacy and you insist you need a medication.
Okay.
We are sorry, we can't help.
Okay, great. That's understood. So if I've come from the US and I've suddenly run out of, let's say, antihypertensives, ideally I should see somebody before and get a prescription.
Yes,
I cannot
please.
just come and say, I've been on this in, let's say, Kansas, and I'm here, and you will dispense that medication. You will not dispense that medication?
You being the pharmacist, if you are to dispense the medication, something should happen. The law will come after you.
Okay.
So we always advise, see a prescriber,
Mm-hmm.
talk to the prescriber about your condition. He'll be in the right states to prescribe medication for you. Then you come to the pharmacy, you get it.
Yes, and
Okay.
then just to add to that,
Mhm.
okay, it brings to bear what we call the rational use of medicines.
Okay.
Okay, and as a pharmacist, you are more like the forefront in ensuring that medicines are taken at the right, medicines are taken by the right person at the right dose at the right time.
Okay.
Okay, so there are reasons why these medicines are given. You are on some antihypertensive.
Mm-hmm.
What's your current readings?
Okay.
Have they done the necessary labs currently? Okay, so all these things come to bear in analysis before a particular drug will be chosen.
Mm-hmm.
What if you don't have to take that particular medicine? What if there has to be 2 drugs? What if there has to be a reduction in the dose?
Okay.
So pharmacists are supposed to ensure that the right person is taking the right drug.
Okay.
That is the inspiration behind.
Right person taking the right drug at the right time in the right dosage. That brings me to with food, without food, after meals, before meals, and all that kominini, and the 3 times daily, etc. Can we break this down? When we say take your medicine with food, or medicine should be taken with food, what do we mean by that?
Certain medications, food helps with absorption of the medication. For you to be able to get the full effect of the medicine,
Okay.
food is sometimes needed.
Mhm.
Because for some of them too, we advise you don't take them with certain foods as well,
Okay.
because there's drug-drug interactions
Right.
with food or drug itself, or certain diseases with drugs.
Okay.
So we always advise our patients to take it with food. Some of them form insoluble complexes, and that you don't get a full effect.
Okay.
So we always advise them to do so.
What does it mean when you say with food? Am I eating at the same time as taking the medication? How different is with food and after meals, right? Is there a time span when it's written or instructed, take after meals, right?
Yeah.
And take with food. Is there a time limit or specification, Daniel?
All right, so with food means that the drug works best with food in terms of absorption.
Okay.
The same with after food.
Right.
Okay, so there are some medicines that you'd have to take. So you're about to eat, then you take them, then you eat.
Okay.
Okay, so that could fall under with food. Or
Okay.
you are eating,
Mhm.
and then you pause, you take,
All right.
then you continue eating.
Okay.
Okay, then you have after meals. So you are done eating, then you take
Okay.
the drug. Yeah, basically.
So after meals can be what? An hour after?
Okay, for that, it depends on the drug.
Okay.
But mostly within the next 30 minutes.
So
you
shortly
should-
after
yeah,
your meal.
Yeah, shortly after your meal.
Okay.
Yeah.
Right. Most people, right? I'm playing the devil's advocate here, but most people would take tablets, oral tablets or oral medication, excuse me, with water. Can you take your tablets with anything you desire or prefer? If you have to take oral medication, some people, I've heard some people say, I even a sip of beer or something still goes down. What's the instruction there?
Okay, so we always advise patients to actually take their medications with water.
Water.
Don't use alcohol.
Okay.
Because alcohol would react with your medication.
Okay.
And this would increase your risk of side effects of the medication.
Mm-hmm.
Because let's take a drug, for example, an antibiotic with alcohol, metronidazole for an example.
Okay.
This undergoes a disulfiram reaction, where if you don't take care, taking the medication with the beer, you have hypersensitive reactions all over our body, rash and all that.
Okay.
We try to avoid them. So please
take your medicine
take
with
your
water.
medicines with water.
What about fruit juice? Sobolo. I'm coming home, straight home, because there's a lot of this around, especially during this period, lots of fluids, right? Would that affect the medicine? Or to be safe, just take it with water?
Yes, to be safe, because sometimes some of the drugs, especially with the plants, most plants, as pharmacists, we study plants as well.
Okay.
Most plants have a lot of constituents, okay? And these constituents can interact with the medicine.
Okay.
So to be more practical, for example, grapefruits.
Right.
Okay. Grapefruits, there's an enzyme in the body that metabolizes, or let me say, break down most of the drugs we take.
Okay.
Okay. We call it a cytochrome P450. Now, this enzyme, okay, breaks down most of the drugs that we take. Now, you like a regular grapefruit. Grapefruit is good. You get your vitamin A, you can get some vitamin C from your grapefruit. But when you are taking some medications, okay, it's going to interact because the grapefruit is going to block the action of that enzyme. Okay. So when that happens, more of the drug will be available in the bloodstream.
All right.
And the moment you have more drug available, you could have more toxic effects. It could be quite harmful.
Just caused by the I said grapefruits.
Yeah, exactly.
Yeah. Affecting the breakdown.
Yes, exactly.
Okay. Right. Nortey, good afternoon. Regards to your guests as well. In a pharmacist and diagnostic center where I work, the pharmacists always do consultation and requests for laboratory and scans for the clients. Is it really their job to do so? At the end of the day, they just give medicine. So Mike essentially is asking, what's the jurisdiction of the pharmacist? He's talking about a situation where pharmacists are doing consultations and lab requests as well. He doesn't mention the location. This is from Mike in Adenta. So what's the jurisdiction of, or the role of the pharmacist? Are these pharmacists he refers to, are they working or functioning outside their role?
Not necessarily, because a lot of people don't know. But then a pharmacist is trained to diagnose and treat diseases of common occurrence.
Oh, I see.
So when you go to even other countries, the government is investing a lot in pharmacists, in community pharmacies,
right,
to reduce the burden in the hospitals. Okay, so in treating diseases of common occurrence, the pharmacist may request for a lab. Okay, just like even now you have rapid diagnostics. Tests that we perform to aid.
The RDTs.
So in to arrive at a proper judgment, he or she may want to, but there are cases where the pharmacist would have to refer.
Okay,
but let's have the understanding that community pharmacies are supposed to take the burden away from the hospitals.
Okay, right, and therefore with certain diseases or conditions, they may
common occurrences, simple ailments.
Right,
yes,
so they may go into diagnosis and may request certain follow-up investigations. If you have any questions, 055 11 11 997. Those are the buttons to push to get to our WhatsApp. And I think I can activate the phone line, 0302 216 541. 0302 216 541. Those are the healthy buttons to get into Ultimate Health on Joy 99.7 FM. We're looking at managing your medicines over the festive period. We've got pharmacists from Ad Pharma, but the information, the tips, and the education is universally applicable. So share with us 055 11 11 997 your questions, your concerns, your experiences, and you can call us on 0302 216 541. So let's look at this issue as well. So we've talked about water, right? People are going to be taking a lot of beverages, many of which are alcoholic and unfortunately free during this period. What's your advice for persons who are taking medications on a regular basis, and even just generally for people? Alcohol and medicine. What's your advice?
So during this festive season, there is an overindulgence of drinking, eating, and being merry.
Okay.
So we always advise our patients not to take their medicines with alcohol because of side effects issues. It increases your risk of getting some reactions. Then again, we also advise them because taking the alcohol together with your medication, some of the medications causes sleepiness, blurred vision, and a whole lot.
All right.
So if you are taking it with alcohol, with the medication, that we have a mechanism in the body, which is the blood-brain barrier,
Right.
where alcohol is not supposed to cross it.
Okay.
Taking that with certain medications, the medication will cross it. So you having these two things coming together would build a synergistic effect,
Right.
which will make it cross the BBB, that's the blood-brain barrier.
Right.
In this case, the side effects you're actually going to have would be unpleasant.
Okay. Right. Let me break it down this way so that my listeners, let's say I'm hypertensive, right? I have my time, I take my antihypertensive, right?
Yeah.
So let's say I took it this morning. There's an engagement or a wedding or bunyo party or Xmas bash or something that I'm going to later in the afternoon. And I get there and I indulge. I take a bit. It's offered. It's free. My medicine was taken in the morning. What's the big deal?
So if your medication was taken in the morning, the medication had been dissociated in the system already.
Okay.
So although you take the alcohol later in the day, it wouldn't have any effect on the medication.
The medication will still work.
The medication will still work because it has been absorbed in the blood stream already. So you wouldn't have much problem with that. But then we always advise, take the alcohol in moderation.
Right.
And then to add to that, you are a known hypertensive.
Right.
You should know that your organs are, I wouldn't say in danger, but
Under pressure.
yes, we need to be careful.
In danger, I agree.
Uh-huh.
Yeah.
And you know, alcohol has its own influence on the liver. So it wouldn't be ideal. You know, it will put you at risk if you're hypertensive. You put at risk of other conditions like diabetes.
Okay.
Put at risk of what we call gout or this kind of arthritis or
Right.
arthropathies. So it's not ideal.
So it's a no-no.
Yes.
Right.
And because you see, recently Ghana launched its alcohol policy.
Right.
I mean, the alcohol policy, I think around 2017. And one of the publications that was made from the Ministry of Health stated that about 23.3% of Ghanaians consume alcohol. Okay, and then about 2.1% were heavy drinkers. For me, in the festive season, these statistics would either quadruple,
Okay.
triple, or something of that sort.
Right.
And it wouldn't help.
Okay.
Okay.
So alcohol is a no-no. Know your condition. Know what you're supposed to do. I have a caller on the line. Hello. Good afternoon.
Good afternoon, doctor.
Hello.
Doctor from Auntie Elizabeth.
Auntie Elizabeth. What for everything?
Nakasa or Dansuman.
Okay.
Mopocho, I can't there. Doctor said there. Yes, you do. I remember in some say do. Let me look their life. Our life is water. Life is water. But drink is not our life. So you should stop taking medicine with drink.
Okay.
That is all what I want to say.
Thank you so much, Auntie Elizabeth. Yeah, that's it. She's saying life is water, and alcohol or alcoholic beverages are not part of that whole formula, so we should avoid this combination. Right. Good afternoon, Nortey. Please, can you take medication with ice water? This is from Gladys in Adenta. Ice water.
Okay. So this will take us back to chemistry.
Mm-hmm.
Okay.
Let's hit the answers quickly so that we can take more. Yeah.
Temperature affects the rate of a chemical reaction.
Okay.
A drug is a particle, it's a substance.
Okay.
So it's put together. Okay. So what will happen is that when you take it with ice water, before the drug will start working, okay, it has to now, when it gets into the body, the drug will have to now undergo a physiological change.
Okay.
Okay, into a right temperature, a right pH before, so it's going to slow down the absorption.
Okay.
But mind you, there are some drugs that work best with cold drinks.
Right.
So that's just to, so you are looking at the chemical stability of the drug.
So typically we're talking about regular lukewarm water.
Exactly.
Right.
Yes,
Or yeah. Okay, not chilled or iced water.
Not chilled or ice water.
Okay.
Yeah.
Though there are some situations where you say it may not have an untoward or a negative effect. But generally the rule is that don't take your medicine with ice water.
Or hot water.
Or hot
Because
water.
that also break the particles.
Oh, okay.
And the drug will be more readily, or it will be broken down into units. By the time you reach the site, you would have lost most of the drug for absorption.
Okay, great. If you have questions, 055 11 11 997. The phone line is 0302 216 541. Ultimate Health on Joy 99.7 FM with me, Nortey by nature, with the pharmacist in the studio, Pharmacist Sai Obodai and Daniel Sarpong from Ad Pharma. If you have your questions, share with us. We're also live on Facebook and YouTube. It's 38 minutes past the hour of 2. Right. Blurred vision, drowsiness, loss of coordination, impact on reaction time, and so on and so forth. People are going to be moving and driving and operating their vehicles during this period, and they will still be hopefully compliant with their medications. Any word or advice on this? Because people will be traveling, or we are going to Auntie Chocho's place, or we are going to Central Region for this and this and that. Yet I've taken my medication and I'm the one behind the wheel. Gentlemen, any comments, cautions?
Yes. So certain prescription medications and over-the-counter medications may affect you in a way.
Okay.
So it makes you unsafe to drive. Moreover, it's against the law to drink whilst you are impaired.
Right.
Yes. So there are 3 things you need to know. First, you check, and you stop.
Right.
So know how the medication would affect you. Secondly,
and you will be told, you'll be educated that this medication, and sometimes you see it on the packaging.
Yes.
This medication may make you drowsy or will make you drowsy.
That's true.
Right.
And some of them, they are very in a hurry to just walk out of the pharmacy. So they don't give a listening ear to the advice. So then again, you check. If you check before driving or how you are feeling, then next you stop. Stop driving or don't start driving at all. These are the 3 main things you need to know.
Okay.
If not, the side effects start setting in.
Right.
Blurred vision, sleepiness, drowsy. There'll be an accident.
Okay.
Yeah, so just to quickly add to that. Okay.
Right.
So
let me just take this call and then come back to you.
Right.
Hello, good afternoon.
Good afternoon, Nortey.
Yes, who am I speaking to?
This is Alex from Hachu.
Right, Alex, you're welcome. Share with us.
Thank you very much, one of your regular listeners. My question to the pharmacist in the studio is what specific steps are pharmacists actually taking to ensure that in dispensing drugs to persons who are blind, for instance, they give relevant descriptions for the individuals to be able to take the drugs independently.
Okay.
Rather than this practice where if I met you, Nortey, by the roadside and asked you to assist me into the pharmacy, they explain how the drug is taken to you, who they don't know,
right?
Where I got you from,
and
got you to assist me.
Right.
So it is important that we pay attention to people coming into the pharmacy who are persons with disabilities and how we engage them, even for us to consider how we label that so that these individuals like myself can take them independently.
Okay, so you are visually impaired.
I am totally blind, yes.
Right. Okay, great question. Right. So he's talking about how you give education to the visually impaired, and sometimes somebody's accompanied, even though they are the one who's visually impaired, and the explanation and the instruction is given to the caregiver or caretaker or the accompanying person. He's asking, how do you do this so that the person can take the medication rationally, safely, and independently? Hang on to that. This is from Dede in Maryland. Dede, you're welcome. It says, people don't know their conditions? Seriously? This is puzzling. Isn't it the prescriber, and probably with the help of other healthcare providers, labs, etc., who diagnose their conditions? So does it imply that prescribers don't explain their conditions but just go ahead and prescribe the meds and all the lovely stuff and leave it to the pharmacists or the chemical sellers to do their explanation? And she's also asking, what is the meaning of slow release for some medications? What is the meaning of slow release? So we have firstly the question for the visually impaired. How do you give them information and education and make sure they can safely and independently use the medications? Yes.
All right. So with a visually impaired, for such a person, you would hope that he or she has a caregiver.
Right.
Okay. So at least when he or she comes, he comes along with a caregiver, and I think I've met a couple of visually impaired people who could actually speak well, like they understand.
Mm-hmm.
So yes, they are visually impaired, but at least they can speak, they can communicate well. So in such situations, it's not that cumbersome to actually explain anything to them.
Okay. Are tablets designed in a way where they can use tactile, identification strategies or techniques?
Okay, so some packs, some drugs have some prints on it, which they can use to read and know.
Okay.
And then most of them, I don't know, maybe it's some kind of special tea that they get to acquire.
Right.
But they're able to hold a tablet
and differentiate
know that, yes,
the
this
tablets.
one, it's so amazing.
Wow.
Trust me. So it's that also
right. Dede is asking, don't prescribers, don't the physicians, the primary caregivers, don't they explain people's conditions to them? Obviously, you do something which is supplementary, right? But she's worried that people may be walking around purchasing and procuring medicines and they don't understand properly their conditions.
Well, it's not their fault, because most of our prescribers have a lot of patients on them.
Right.
So sometimes, in the heat of the moment, then they rush to see the patient and move on to the next person.
Mm-hmm.
So, pharmacists.
So they would explain all right, but maybe
so time pressure, doctor-patient ratio would affect that communication.
And there was a survey that says pharmacists are the most trusted healthcare givers. So they tend to actually.
I thought it was psychologists, but no problem. They tell us a lot. Go ahead. Mm-hmm.
So most of them tend to listen to us.
Mm-hmm.
We have the time, tell them about their condition, why they are taking this medication, and that's the most important part of it.
Right.
Understanding your condition and taking the medication for it.
Right.
If not, they'll just be taking their medication, or sometimes they wouldn't even take it at all. I'm tired of taking this medication.
Okay.
But the moment you understand, you are good to go.
Okay. Slow release medications. What are those?
All right. So you have drugs that are readily absorbed or readily released.
What does that mean? Break it down. Release it.
So with a slow release, some medicines are formulated such that their action or the desired effect of the medicine, is given over a period of time.
Okay.
The reason why some medicines are slow release also is because of the effects, the side effects. So, for example, instead of about let's say 10% of the drug to be released, you have maybe it's released in bits, maybe 2%.
But it's in your system.
Yeah.
It will be absorbed.
Yes.
But then its effects will take time to manifest.
Yes.
That's what we mean by slow release.
Yes, exactly.
Okay.
Yes.
Right.
So
Whereas some are quick acting.
Exactly.
Okay.
So you don't have everything dissociating in your blood
Okay.
system. Yeah.
Right.
It takes time.
My pharmacist like big brofo, and me, I dilute but so it takes time for the effects to show,
Yeah.
Exactly.
right? And therefore, once you take it, and that's also important in making sure that you are taking it when you're supposed to take it, because it's actually still in your system.
Yeah.
So if you take another dose before you are supposed to, then you are increasing the level in your system. Am I right?
Exactly.
Okay.
And that could come with bad effects.
Okay.
Yeah.
Right. Okay. If you have questions, concerns, 055 11 11 997 is my WhatsApp, and the phone line is 0302216541. We are engaging the pharmacists with regard to managing our medicines over the period. What about those who are asthmatics, those on chronic medications, right? They seem to feel they know their stuff and they play a lot of hanky-panky, right? They've learned and developed and acquired all sorts of shortcuts. We'll come to that in a second. I have a caller on the line. Hello.
Hello, good afternoon.
Yes, good afternoon.
Yes, Mr. Lassie. There was a question asked by one of the callers, Alex, and he was asking about the persons with visual impairment and how sometimes the pharmacists are not able to, tell them how to take their medicines. For instance, and the answer wasn't forthcoming properly. For instance, maybe I meet somebody even on the street. Maybe I'm going alone to the pharmacy and I meet somebody on the street, and the person helps me to the pharmacy. Then I get into the place, and then the person says, the pharmacist says, tell him to take 2 spoons and 3 tablets. At least the pharmacist should be able to tell me, the visually impaired person, that okay, this particular pack, take 2, 3 times a day. The other one, take it once, 3 times a day. Then you show it to the person, let him hold it, and then tell him, okay, this one, take it 2, 3 times a day. The other one, that short one, take it once, 3 times a day. You understand? But not to tell the caregiver, because maybe the caregiver does not know me.
Right,
Yeah,
point
so
well
that's
taken.
my
I think they
contribution.
tried to explain that it's the clarity and the time span within which they were giving the response, right? So I have another call on the line. Hello.
Hello.
Yes, good afternoon, sir. Your name, please.
Fine afternoon.
Yes, who am I speaking to? Where are you calling from?
Yeah, I'm calling from Amasama, and my name is Evans.
Evans, go ahead quickly.
Yeah, please. My question is, you were talking about taking medicines with something like minerals and other things. I want to know if, for example, I want to take a medicine, the tablet, and I put it in a fufu and take it. What's the effect?
Put it in your fufu.
Fufu, yes, or banku and swallow it.
Hey, Evans. All right. You are laughing. I'm sure you took your coronavirus with fufu. I said virus. Your vaccine. All right. Right. Let me just quickly run through these and come for responses. Nortey, thanks for the great work done, and best regards to your apothecary in the studio. Bro, please, may I know, is it a healthy practice? I took medication, and about a minute later, I dressed up the medication with banana and watermelon and peanut and milk mixed all together in a bowl. Dagati at Dansoman Petroleum. Let me try that again. I took my medication, and about a minute, I dressed up the medication with banana and watermelon, peanut and milk, and mixed all together in a bowl. I don't get this. Guys, do you get this? So he mixed it all up and
Yeah,
took
so-
it together.
Yeah, so it depends on the medication he took. If it's an antacid he took,
Oof.
the antacid would actually react with the milk,
Okay.
because milk contains calcium, magnesium, and these are metals.
Okay.
Consider them as that. So this would form an insoluble complex.
Right.
That would actually affect the absorption of the medication.
So he may be compromising the effect of the medication.
Yes.
But we don't know the medication
We
he
don't know
took.
the medication
right?
he took, yeah.
So water is best because it will not interfere with any of these things.
Yes, please.
Right? Okay. So Dagati in Dansoman, please. Banana, watermelon, milk. In here. Ade. Hey, you are a master of mixtures. I have given you the degree. Good afternoon, Nortey. A special good afternoon to the Ad Farmer team at Tema Community 7, especially Daniel. Great team, always ready to help. This is from Dennis. Okay, Dennis. Thumbs up to the team at Community 7. Hello, good afternoon. I bought this Tabia Takum Bites for the holidays. You bought it for the holidays, okay. I learned it enhances libido, not lipido. Libido in men during sex. And I want to ask your resource persons whether I am safe. Oh, ED. And you're called ED as well. Hey, Chineke. From North Kaneshi. Tabia Takum Bites. Right. Firstly, I will say from my side of it, if you have anything related to erectile challenges, get that investigated. It could be a signal of many possible underlying conditions. So, first and foremost, you are trying to resurrect, well, not the dead, the dying, the weak, but I need to know, and I would want you to know what you are managing or treating first and foremost. But Tabia Takum Bites. He's talking about libido, but I'm sensing erectile challenges in there. Quick response to that.
All right. The fact that he has mentioned the brand name, it's a bit.
He mentioned it, so go ahead.
Yeah, so
he's talking about these. Let me talk about aphrodisiacs, these enhancers and things like that. What would you say?
So
Maybe during this festive period, that's when he wants to perform. Okay. I don't know why, but if he has a problem, he has a problem. But during this festive period, he's bought it for the holidays.
Yeah. So I would want to answer it not with regards to a brand name.
No problem. Shoot.
Yeah. So basically, if you feel you are having some kind of erectile dysfunction, anything of that sort, first and foremost, you need to have it investigated.
Okay.
Here I see self-medication, which is not appropriate. Okay, so you would want to get it investigated,
right,
and then find out, is there any underlying condition before?
Okay.
Is the person hypertensive? Is the person taking any other medication? Because some medicines also cause erectile dysfunction.
Definitely.
And then premature ejaculation as well. So we would want to do a thorough analysis of the whole thing.
All right.
Before we proceed from there. But we can start with nutrition. I mean, get a good nutrition, get some good vitamins.
Right.
Gingers and ginger officinale is good.
Okay.
I mean, a host of them.
Okay.
Yeah.
Right. ED. ED also stands for erectile dysfunction, but I won't say anything more. What should I do if I miss a dose of my medicine? Ikuya from Dansoman.
So if you miss a dose, we advise you to take it as soon as you remember, but don't double the dose.
Okay. As soon as you remember, take the dose.
Yes.
Not wait till the next time.
No.
All right.
Yeah.
So as soon as I remember, take it.
Yes, take it.
Okay. If it's close to the next specified time?
So if you are taking it 12 early, and let's say you took the first dose, you missed the first dose, which you are supposed to take it as, let's say, 8 a.m., and you are supposed to take the next dose at 8 p.m., and you remember, at 4 p.m., I didn't take my medication at 8 a.m., just take it, and then don't take the next dose.
Okay. All right.
That's okay.
Okay. Is it advisable to take drugs with milk or soy, especially the malaria drug?
All right. You can't take all drugs with milk. But some drugs, I mean, some anti-malarials can be taken with milk.
Okay.
Actually, they work best with milk.
Okay.
Yeah, so with fatty foods.
Right.
So milk falls under that category. If it's artemether lumefantrine, I mean, you can do it with milk.
Okay, it's me, Mike, again. I know a lot of pharmacies in my area that sell a lot of abortion drugs. Abortion drugs. Is it legal? Is he talking about the post-exposure? What are those ones called now? Contraceptives.
So
I think maybe that's what he's referring to as abortion drugs.
Okay.
Or?
Probably. But then if it's saying
Mike is typing.
drugs,
Yes, quickly, Mike.
It's illegal to dispense.
He's put a name up there. You can see it on the screen. Mifepristone, Mefabon, and other things. I didn't want to read it out, but what are these?
So these are abortifacients, and it's illegal.
They are what?
Abortifacients.
Right, what does that mean? Don't speak as if we are pharmacists, otherwise I'll blast you. Right? What are they?
So these are medications that would help to induce labor.
Okay.
Yes.
Right.
So it's illegal to actually dispense this over the counter.
Are these over-the-counter medications?
No.
Should anybody be selling them over the counter?
No.
All right.
These are prescriptions-only medicines.
Okay.
So.
And he says he knows pharmacies that are selling these.
This is illegal. I don't think that very person is a pharmacist.
Right.
But first of all, we would have to as to whether it's true. As it stands
No,
now,
I'm not interested in whether it's true.
Okay.
We're giving information and education,
All
right?
right,
So these are not over-the-counter
No, they are not.
substances.
They
If
are
a
not.
pharmacy is doing that, how does he report this and to who?
All right. So currently, the Pharmaceutical Society of Ghana has
Right.
a regulatory umbrella.
Okay,
Okay, that is looking out for some of these things.
Okay.
In terms of fine tuning the profession.
all right.
So first of all, he can make such claim
Right.
or make such report to either the administrator of the facility.
Mhm.
I mean, you can just walk in and ask to speak to the owner of the facility
Okay.
or the administrator, and then start from there.
Okay.
So basically.
Right, Mike, type it out and I'll see if I can get in touch with you, okay? We're not saying it's true, but it's of concern. So how many hours after taking meds can one eat anything without having drug interaction? This is from Dede in Maryland. Is there any effect when you chew medications that are meant to be swallowed and vice versa? So they say swallow, don't chew. And then you chew because you are stubborn like me. Quickly, we're running out of time.
Okay,
Any
so for some of
effects?
the medications that are supposed to be swallowed, it's because of the taste.
Mm-hmm.
If you are to chew it, because the taste is bad,
Okay.
we advise you actually swallow.
All right. Does it affect the impact or the effect of the drug?
Sometimes it does.
Sometimes it does.
Yeah.
So follow instructions.
Please do.
Okay. My pharmacist, please. I am on X-Fog for my BP. It makes me feel sleepy after some hours of taking it. Please, what is the best time to take it? Before going to bed or ...
Okay, so this is what we call patient review or drug review.
Right.
So it will have to be reviewed.
Right.
Okay, because if he's taking it in the mornings and we are getting results.
Okay.
Okay, we need the data. So
Right.
you are taking maybe one a day
His
in the morning.
primary physician will have the data.
Yes.
So he can review this and
yes,
take these
so-
decisions
yes, so he
with
can-
his
yeah,
physician.
yeah.
Okay. Sorry, I'm rushing because we're almost out of time. The gentleman who sent the message said, Nortey, my problem is premature ejaculation. Okay, ED, I will get back to you and see what we can do. Sir, please, my uncle had gout, so his physician prescribed a medicine called allopurinol for him. He takes it every day, one a day. Listening to the show, please, is there any food that he needs to avoid? Derek in Teshi. Quickly, anything you want to say to that?
Okay, so he does gout. So
Yeah.
one a day, same time each day. That's fine.
Right.
He needs to avoid red meat.
Red meat.
Because they
Okay.
are rich in what we call purines in
Mhm.
chemistry, and those
Okay.
purines they increase the levels of uric acid in the blood. And
Okay.
someone suffering from gout, that
Mm.
wouldn't be beneficial.
Okay.
Alcohol also would not be beneficial to
Avoid
someone
alcohol,
suffering.
red meat.
Exactly.
Okay.
Alcohol, red meat, pork, and all those things. would
All right.
not, yeah.
Right. But also talk to the primary provider or caregiver who prescribed the allopurinol, right? For better information as well. Thanks for sharing. It educates all of us. Please, I've been treated with malaria. Can I continue to take the drugs to avoid future recurrence of malaria? So the malaria is gone. Can I just download it as an app and continue taking the malaria drug?
No, it's not advisable.
Okay.
It's not advisable.
Because even there's something called recrudescence. It can bounce back, but some of the anti-malarials now are able to, grant you protection
All right.
for some number of days.
So you don't
Like
need to be
Paramax like this,
right. You
yes.
don't need to be taking
You
it
don't
all
need
the
to
time.
be taking.
All right. The self-medicators are now typing. Hello, sir. Folic acid. Is it good for me? For men, sorry. Hey. Is folic acid good for men?
Well, it's a nutritional element, so
Right.
And what folic acid does is it helps with the formation of cells. That is why you see most pregnant women
Pregnant
on it.
women, we give them folic acid. Yeah.
Yes.
Right.
So for men, it's not bad.
It's not bad.
It's not gonna hurt him.
Even for function, you can read on it, and
Okay.
it helps with the men function.
Alrighty. Lots of things we didn't get to discuss, but hey, my pharmacists are around. They are from Ad Pharma, several branches available. You've been listening to Pharmacist Sai Obodai
Yeah.
and Daniel Sarpong from Ad Pharma. Most of your pharmacists should be able to and should be well resourced to give you information and education. Make sure you don't mess with your medications during this festive period. But we will try and bring them back again to continue the education. We didn't get to talk about asthmatics, contraceptives, and other things that you will miss or mess around with during this festive period. Stay safe. stay compliant with the COVID protocols, and stay tuned to Joy 99.7 FM. Thanks, gentlemen, and we'll see if we can bring you back to give us more information on our medicines during this period. Right, and many thanks to my producer, Abekusa Kofi, and of course, my discerning listeners who make me proud all the time. Wow, banana, watermelon, peanuts, milk, and medicine. That does it for me. I'm out of here. Stick and stay. I hand over to Bilay for Sunday Rhythms on Joy 99.7 FM. My name is Nortey by nature. I'm out.